everybody. So I just wanted to hop on here today to kind of talk to everyone about what's going on with me. I think I'm like, actually I haven't figured it out. I think I'm like 15 weeks out from prophylactic mastectomy with the DIEP FLAP Reconstruction. For those of you that don't know me and haven't seen my prior videos, that means that they took the belly fat and made new breasts out of that tissue instead of implants. And I wanted to document my process about how everything was going. So I just wanted to give a little update about what's been happening. This is not to scare people. This is not for a pity party. I said in the beginning that I was going to tell people what was happening and how I tried to deal with things. So last week or 2 weeks ago, I kind of mentioned I went back to work. So I've been back to work 3 weeks now. And I was getting this like pretty intense back pain right through like here and kind of in my rib cage. And it was kind of like a spasming, which it's funny because that's exactly what I felt when I got out of the hospital, or when I was in the hospital and I kept trying to walk, although that was excruciating pain, like spasm so bad that I couldn't breathe and that was when I was in the hospital. Since then I've been doing tons of stretches and strengthening and doing significantly better, but I would just get this little back spasm. So I just kind of thought, you know, as time goes on, it's just healing, it's just got to get used to activity, I'm fine. And then I went back to work and got pretty bad that week, so I got a massage and I saw a physical therapist, and they kind of balanced my hips and got into that tissue and it was doing better. And then about a little over a week ago, my entire hip completely locked up. So I wanted to come on and really talk about this because, number one, this was kind of one of my big fears of having this surgery, because I know what scar tissue can do being a physical therapist. So just to kind of get into scar tissue, you know, some people think the problem is only at that scar tissue position. So it may not be though. So if you have scar tissue through here and then you have scar tissue here because of the drains, and then you have this huge line of scar tissue here, which a lot of other women have too, you know, if they have tummy tucks or if they've had C-sections. I don't think people realize how much that can affect you later on down the road. So I've been feeling really tight through here, and so I've been doing tons of stretches and yoga, and I honestly think I'm doing pretty dang good compared to some other people that I've heard that maybe haven't been stretching quite so much. So I did start backing off a little bit on my exercises when I went back to work, because life gets crazy. And I think that's kind of when things started developing, when I kind of slacked off on my exercises. So scar tissue, if you have an adhesion here, so if I use this shirt as an example, you know, when I pull the shirt down here, it should pull all the way up through here, okay? See how it kind of pulls down there? Now, if I have an adhesion here, which I do because of my abdomen, it no longer pulls correctly, okay? So if I don't get this released, I could have problems here, or I could have problems here, or I could have problems here, which is kind of what I'm feeling. So when you walk, your pelvis should move equally and symmetrically back and forth. And what's happening with me is that my right side is not moving and my left side is moving more to take up the slack. So this is kind of leading into more fascial tightness all through here. I've been getting pretty severe hip pain, and I'm still having that back pain. So what have I been doing about it? Everything known to man, basically. So I've gotten deep tissue massage. I have seen a couple different physical therapists. I have tried dry needling my scar tissue. Here's the thing, you know, some people might think, let me stretch that out. And it totally depends on what you're feeling. You could try to stretch, and if you feel like you can get a stretch, then great. Maybe it's just fascial and muscle tightness. But for me, like I get a pinch, like a really severe sharp pinch in my hip joint. And to me, that tells me something's wrong. Something's not right. It's not just a fascial issue. If it pinches and it hurts, I know I need to go get this worked on, okay? And the reason I'm hopping on here to tell you this is because I think a lot of people might think this is normal, it's just gonna take time, you know, I need to get used to working, and people let these things go on way too long. And then by the time that I see them or another healthcare practitioner sees them, if it's been 6 months to a year, then man, it's so much harder to work with than if you treat it right away, okay? So I just wanted to let people know, if you're feeling something and you're in pain, go see someone. Talk to your doctor. Unfortunately, your physician for your surgery, your plastic surgeon, probably not gonna be able to help you. They're not gonna know. So they or someone else can write you a referral. So then you're gonna have to do your homework. So you can ask your physician, if your physician is in your local area, hey, who do you know? You know, maybe they can refer you to somebody. But what I would recommend for something like this is to find somebody who does a lot of body work, and specifically like osteopathic type mobilization and manipulation. So if you know a good chiropractor, they might be able to help you out. A physical therapist, if they do a lot of that body work and that osteopathic manipulation. I can tell you for a fact that exercise alone was not going to help me with this. I know what exercises to do, but I had to go see someone to kind of help me. So I've been seeing these people and it's still hurting, but it's better. So now that it's better, I'm actually getting ready to leave here to go to hot yoga, and I'm gonna kind of feel it out. Because I feel like now I can stretch it a little bit better. Sometimes it still hurts and it's pinchy, but I know when to back off. So I'm gonna go and try to kind of stretch all of this out, but I'm also gonna listen to my body, and if I can't do something, I'm not gonna do it. So I hope that helps. If you are having back pain, which is very common after the DIEP flap, I'm gonna get on here and show you a couple stretches that should help if it is just like your typical back pain. A lot of times people want to go and stretch the back, but the problem is from all this anterior tightness and scar tissue that we have had done to our body. And so it's really, a lot of times it's about opening up the chest, opening up this tissue, and trying to get this to be able to expand so that this part of our body doesn't have to work so hard. And so I'll go and post a couple stretches that I've been doing that are helpful when I'm able to do them properly, because right now, like I said, I'm a little locked up. So we'll see how I'm doing after some yoga and some more treatments, and then I can show you some things that you can do at home. But like I've said, a lot of these exercises I think are really good for like preventative, to prevent this from happening. Kind of, you know, smacking myself for, gosh, Jamie, you know this, you should have been stretching as soon as you know, every day before you went to work. But it's hard, you know, I have 2 kids to take care of, and I gotta work, and I gotta do all the mom things, and it's hard to get up early and stretch, but super important to do so. So I hope that helps. If you guys have any questions, please comment below or shoot me a message. Okay, have a great day.